The Shop for Care report or Shop for Care tool that we're going to talk today. This has a long history, and a long history as long as the Colorado APCD exists and is present for you to use. But a few years ago, we had a very an in-depth review of how to improve the Shop for Care tool, and the communications team led by Kerry and Kerry Frank did a series of focus groups with consumers to decide what was best for consumers to understand the information. So they held two different focus groups that informed how to display the data and the design of the report. We also conducted a review of literature and learned from other states about what they were doing and what type of procedures and processes they were reporting. And then we conducted an overall website design testing with consumers to make sure that what was there was easy to understand, or as easy as possible at the moment. You know, there is always opportunities for improvement, and we always take them. The Shop for Care includes, and I'm going to tell you in general what includes the Shop for Care report, and then we're going to talk more specifically about the different services that are described in the Shop for Care tool. In general, the Shop for Care includes services that were paid by commercial payers only in the Colorado Payers Claims database. What that means is that we are not showing the prices that Medicaid pays for these services or that Medicare paid for these services. As you know, most of the variation in prices is in among the commercial payers. We do not include, because by federal legislation, we do not receive that data, what is called there the no ERISA-based plans. These are the plans where the employers are self-funded. They finance the healthcare of their employees. So those are not included because we do not receive the data from those plans because of federal legislation. And also, we do not include the self-pay rate, which that means that anything that if I am uninsured and I go to get a service, I pay out of my pocket, that is not included in the APCD because the APCD only includes what health plans and people paid for services, but not when they are self-paid. But they are a good guide to know what the prices are. And we'll talk later a little bit more about that. The services that are included in the Shop for Care tool, that is like a tongue twister for me, so sorry, is the claims with a service location in the state of Colorado. The Colorado APCD has services reported, like let's say I go on vacation to Washington and I have an accident in Washington, therefore I receive services in Washington, but I am a Colorado resident, so that will be included in the Colorado APCD. But for the Shop for Care tool, we do not need to know about the Washington prices. We only want to know about the Colorado prices, so we isolate for those. And we display the prices at the provider facility level. So that means that if I go to UC Health in Anschutz, that is the price that I'm going to see, what UC Health Anschutz is charging for the service that we are describing here. It is important to know that we can only provide prices for facilities that have volumes of 11 or more services. And that is by CMS regulations, which is the Center for Medicare and Medicaid Services. And that is just to care for the privacy and confidentiality of the information. Sometimes some services are not very common. And I know it seems hard to believe, but even when we have millions of people represented in the Colorado APCD, sometimes the heart vessel surgery paid by commercial payers is just low enough for one provider in particular that we cannot show the price. The prices that you see in the Shop for Care report represent median payments. That means if you arrange all the prices from the lowest price to the highest price, the price that is in the middle, that is the price that we are showing in in the shop for care tool. That is called the median price, and we are representing it as an average because it is a typical price paid for that specific service. We also show the prices that are in the 25th and 75th percentile of the distribution, and we do that with the intention of eliminating the very extreme cases that might be very not as common or typical as we describe it here. So we want to provide the most typical information to the consumers. Provider-owned facilities are not included in the report, and this is due to a Colorado law that requires that all provider-owned facilities need to have a quality measure display if we are showing cost. And that is important, particularly for some of the imaging services, that there are many diagnostic imaging services or providers that, I don't know, a group of ophthalmologists that do cataract surgeries, and they are not represented in the report, and it is for that reason. Next one, please. And now I'm going to talk about one of the type of services that we represent, that is imaging services, because there are some specific characteristics to those services. And one thing is that we are only providing prices for services provided in outpatient facilities. What this means is that sometimes you might have, I don't know, you might have a hospitalization, and as part of your hospitalization, you are ordered an imaging service. Those imaging services are not included in this report. And of course, it's for obvious reasons. You don't shop for those services. You are already, let's say, trapped badly in a hospital. You are in an inpatient setting. You are going to have the imaging service right there. You are not choosing where to go. This is only outpatient, and we are only showing the facility portion of the service. And that is represented with a CPT code, which is a procedure code. And the prices do not include the professional fees for interpretation. You know that every time that you have an imaging, you have an X-ray, let's say. You have the X-ray, and then some doctor comes and interprets that exam. That is not included in the price that is shown here. The service dates that are shown for the imaging services are from January to December of 2020. Next one, please. These are just the groups of imaging service that we have. We have in total 30 imaging services in this report, but we have CT scans and MRIs, ultrasounds, X-rays, the variety of imaging services. Next one. The other type of services that we have in the Shop for Care tool, we call procedures. And procedures are represented as full episodes. And we'll talk a little bit more about those because those are not as simple as the imaging services, because they include the cost of typical service that were before, during, and after the main procedure. And I'm going to give you a typical example of something that would be named a procedure. Is, for example, a colonoscopy. All you know that colonoscopies are the gold standard screening for colon cancer. Once you hit 50, they are revising the guidelines, so it might be even younger now, but that's the gold standard screening. So that colonoscopy includes a visit with the doctor first to determine that you needed the colonoscopy. Then you have to do some prep work for the test. And then you have the test, and the test includes the test itself, but then they sedate you, and then the follow-up of the visit, the interpretation of the test. All those costs that are included in the colonoscopy are included in the prices that are included in the Shop for Care tool. If you were talking about the vaginal delivery, for example, if you go and deliver a baby in a hospital, of course, one thing is just the act of delivering the baby, but you know that there are many other costs around having a baby, and they are all those costs are included in the costs that are described in the Shop for Care procedures. And for that, we used some software that is called Prometheus Analytics. And in this case, the data that we're showing here is for 2019. And as I described, the analysis of this data is a little more complex, and we have to do it has several steps. So for us to be able to provide a full year of data, that's the reason that we are providing 2019 instead of 2020. In imaging, in the case of imaging, we didn't have any restriction for age. In the case of procedures, we do only care for 18 to 64. Why 64? Because at 65, many of the people are going to have Medicare insurance or coverage. But with one exception, because we have the tonsillectomy, and as you know, the tonsillectomy is a very frequent procedure in children. Next one, please. This is the long list of procedures that are shown in the Shop for Care tool. And as you can see, many of them are very, very common. And also they are considered, many of them, what is shoppable. And what I mean by that is that, for example, the most shoppable services by definition is the vaginal delivery, because many couples plan ahead, they want to have a baby, and then when they are expecting a baby, they are looking for what would be the best option for them to deliver the baby. So they have time to shop for the best hospital, the best doctor, and the best service. But the same happens when you're going to have a knee arthroscopy, for example, or knee replacement. The doctor tells you that's one of your options, and then you start considering it, and then you start shopping, or you have the ability to shop for that. So the bariatric surgery is another service that could be considered the same, because you have some time to think about it and plan for it. So, but in total, we have 30 services, and we'll look at a little more about those later. Next one, please. Along with those services, we show 2 quality metrics in the report. And as I said, the services are shown at the facility level, and the quality measures are shown at the facility level also. So what is important to say here is that the quality metrics are about the services provided by the facility and not necessarily for that service specifically. For example, we have two quality metrics. The 2 of them are provided and are produced and provided by the Centers for Medicare and Medicaid, CMS, and they are free to the public. And one is called overall hospital rating, and the overall hospital rating has a combination of 7 different indicators of quality, from mortality to timeliness of care and readmission rate and efficiency of medical imaging. So they take a lot of variables into consideration to assign the hospital stars, from 1 star to 5 stars. And 5 stars means that they are the best in overall, and 1 star indicate that they are not as great, or they have opportunities for improvement. And the other quality measure that we provide is related to the patient experience. And that is also a combination of questions. It's a whole survey. And the survey indicates if the patient is explained well the instructions when they are discharged, if they receive good communication from staff, if they are well treated, if they are respected. It's a host of things that speak to the experience the patient has with that specific facility. Not all the facilities that are shown in the report have quality measures, and that is because these quality measures are not available for non-hospital facilities, but at least we have quality measures for some. And this is one area that we will keep improving. The quality measures provided for CMS, some of them keep changing also, so we will keep track of that, of course, and provide to you the best available as they modify. Please, next one. Okay. Oh, and now we're gonna go and go for a quick demo of the Shop for Care report, and we can keep talking about what some of the things that I explained maybe seem a little diffuse right now, but when we look at the actual numbers, I might make a little better sense of the data. And if you have any questions, please, or comments, doesn't have to be a question. Okay. So as you can see, Kerry just went to the main civic.org website, and right on top, the second option in the menu is the Shop for Care report. And that is by design. There are other places in the website where you can find the Shop for Care, but it is right there because it's one of the most searched for reports in the website. And all the public reports are organized the same way. As you can see at the top of the page, there's a brief description of the report and then considerations. That is a guide to help you interpret the information that you're gonna see. For example, it says if you don't have insurance, you can use the price information as a guide to discuss self-pay options. As I mentioned before, this is only based on commercial payers, but it is a good guide if you have no insurance and you need an X-ray. You know that this procedure should cost you about 50, not 500, right? So when you are armed with information when you go ask to the provider for that service. So there is an explanation of how the services are presented. I'm looking at a question from Israel. Hello, Israel. It's very nice seeing you here. And yes, you are correct. The patient experience is based on the CAP survey. And it is a composite of all the different factors in the CAP survey. Anything else? Yeah, no, thank you for your question. And then if you keep going down, usually you're gonna see an infographic that is a summary of the information that is presented in the interactive report. But I would like to go actually to the right side first, because those are the report resources. And there you can click on the methodology and you are gonna find, like, for example, that the CAP survey is the source of the patient experience quality measure that is, or the appropriate link, so you can go there and you're gonna find some of the CPT code descriptions that we use for the reports, etc. We also have collected a list of frequently asked questions from you and from the users over all these years. We provide some additional resources for your reference, like the hospital price reports. So those are different reports, but with different purposes, but they can be useful to read and interpret the data. And then if you keep going down, you are gonna find a link that says download the data. So here you can download just a spreadsheet with all the information that you find in the interactive report. And that's great because if you use the data, probably you want access to data that you can manipulate, and you can just download that. I think I saw a question, Kerry. I don't know if I can read it. This question is from Ira Gorman. Hi, Ira, if you are who I am thinking. I'm curious about the limitation of provider-owned facilities. Does that include a hospital like Ortho Colorado as an example? No, it doesn't include Ortho Colorado. Ortho Colorado, it is included here. It includes what I have found, and really we have, for this one, we pretty much have to go one by one and read the website how the facility is described. And sometimes I miss it. We have a preview period, and we can talk more about that. By legislation also, we need to provide the providers with time to review their information. So we release this report always in advance, 30 days in advance, and we notify the providers only. And sometimes they can come back and say, we are provider owned, and then we eliminate them. And it is, what I found is that mostly some surgical centers that are ophthalmology surgical centers, or also orthopedic surgical centers, but they have like one procedure. For the most part, they specialize in one procedure or two. Those are sometimes provider owned. Ortho Colorado, I think, is included. I saw it in the data. And if it's not included, it is because, or if a procedure is not included, it's because they didn't meet the threshold. And then we have the other languages besides English. That's a great question, Laura, and that's in the plans. But no, so far it's only in English. But we can talk more about that later also. I'm gonna go over the report, the interactive report. And if you look at the first two tabs, the first two buttons, you see you can look first at the view imaging procedures button, and then here you can select the service that you want to look at, and we can choose something that is very simple, like the X-ray of an ankle, right there. And then we can just write that zip code. You can write the zip code where, if you are a consumer and you want to check for yourself, you write the zip code of your residence, and we can just leave that if you want to. Or if someone wants to give me a zip code here, we can look at that one. And then here you can sort the list by the name of the facility, by distance, by average price from low to high, or price from high to low, by patient experience, or by overall hospital rating, high to low. In this case, I'm gonna sort by low to high, from low to high price. And you can see how you have the X-ray of an ankle for as little as $30. And just in this page, you can, the same exact X-ray can go up to $540. So of course, this is in Colorado Plains Medical Center, which is in Fort Morgan. And if you live in Fort Morgan, you might be at a disadvantage, because then if you want something that is at a lower price, then that means you have to travel a little farther to do that. But so you can just see here how the wide variation in prices. And then we can talk a little more about the other pieces of the report. As I said, the average price really is the median price for the procedures provided in that specific facility. And then you have a price range, and the price range is the 25th to the 75th percentile of the distribution, which would mean it captures like the center part of the distribution. It eliminates the extreme cases, whether very cheap or very expensive. But in this case, we have that banner. The typical price is 100, but it can go from 90 to 100. So the truth is that there is no variation. They have pretty much the same price with all the payers that are included in this report. But we have others that have a little more variation, like Pagosa Springs, which median is 150, and they go from 100 to 200. And then you see in Colorado West Healthcare System, I'm gonna move now to the quality metrics. And you see that they have in patient experience 3 out of 5, and in overall hospital quality, they have 5 out of 5. So they are very highly rated in terms of the hard measures, in terms of safety and mortality and readmission, but people report that they are not receiving as good. They are not feeling a great care or they are not having a great experience when they receive care in that facility. So that would be something to consider. If you look at Centura, you can see here the variation in the stars in all the facilities. And you see also facilities that do not have a star, that do not have those stars, and they have an asterisk instead. And they do have an asterisk because either they do not report to CMS because they are not hospitals, or even if they report to CMS, they might not have a number for that specific measure in that specific quarter because they didn't meet the threshold either of patients. So those are the reasons that they don't have. We are very mindful that this is not the ideal quality measures. Ideally, you will have a quality measure only for the X-ray of the ankle. That is very hard to find, and it will be very difficult for us to produce different quality measures for different procedures. But this is a guide for you, particularly for the cost and also for the overall quality of the facility in general. And this is the imaging part, but we have a second button, and if you click there, you see now we move to the other procedures. You remember we reviewed the imaging, which is exclusively the imaging, and this is the other procedures that combine the before, during, and after. And here we can look at, we can select a service. As we review, we have many services. We can look at vaginal delivery. And we can look at any zip code. And then we can sort again by from low price to high price. In the third choice, we have sort list by, and we can sort from low to high. And as you see here, the variation also is large. So we can have a delivery from $8,500, all the way to wow, to 18,000 in this page. So that's 10,000 difference. That's a big difference. So then if we look at the different components of these, you see here, we're gonna look at UC Health Yampa Valley, which is the one that we see here. And you see that the distance from the zip code that we chose, that it was 8129, is far, because you know where Yampa Valley is, so we don't want to go there if we are in 8129. The typical price or the median price is almost $19,000. The price range goes from 14,000 to 21,000 about. And then the price breakdown, this is another piece of data that was not present in the imaging, is about what is the expense pre-procedure, so pre-delivery, during the procedure, which is in this case delivery, and after the procedure. In this case, the price is mostly the procedure, and that's going to be the case all the time. But in some cases, the price might be higher, like in the one just immediately above, which is the Valley View Hospital. So they are 20% of the expenses in that facility are pre-delivery, not exactly the delivery itself. And then you can also have expenses post-delivery that are more significant, like in the other one that is the Colorado Plains Medical Center. And the quality measures are the same in this case. So the quality metrics are for the facility as a whole and not for the specific procedure or service that we are describing. And that's the report. And we invite you to explore and find your prices in your area, or share it and ask questions from us all the time, please. Is that all, or should we just go back to the presentation? Okay, just some highlights from the prices that we found. If you look at this graph, the little numbers on the right, the first two figures represent mammography, different types of exams for mammography. One is for both breast, and one is for a single breast. 160 is the typical price for the both breast. And the range you can see is huge. It goes from $60 to $1,500. And the single breast goes from $60 to $480. And then we have the X-ray, or this was CT scan of the brain. And the median price is $520, but the range goes from $490 to $2,000. And the heart vessel, you can see this is really an outrageous range from $500 to $5,000. With a median of 700. And these are all prices 2020, commercial payers in the state of Colorado, all in the state of Colorado. These are medians for the procedures. And as you see, the colonoscopy again goes from 1,000 to 9,000. The median price is 1,000, about 1,500. C-section, you see the variation is not as huge, but it is actually up to $40,000. Knee replacement and revision is the same. One thing that is important to mention here is that, as I mentioned before, we are eliminating the very expensive and the very low prices. But still, in this case, we are including cases where things didn't go all well. So sometimes things happen when you have a colonoscopy, for example. You can have a puncture or something, and that requires more care and therefore requires more cost. That's included here, but that is real life. That's what happens in real life, that people, not everything, of course, most of the time things go perfectly well and you just have the procedure straight, no complications. But if you have even a little more bleeding than other person, then you're gonna be using extra medication or an extra services that is going to elevate the price. So we eliminated the most extreme cases by eliminating the top 25% of the prices, but still you can capture here some of the complications, and that might be explaining some of that. So it's always good to go with the typical price, but keep in mind that. And keep in mind also when you are doing your research that that's something that can happen. That if you go and pay for a service yourself, if things go perfectly well, then it's going to be this price. But what could be the highest price? And that's good to know in advance. Next one, please. And this is just another graph because we have been producing this data for several years now. So this compares data from 2017 against 2019 because it's the procedures. And if you look at the lowest median for C-section in 2017, they were about the same. And actually the price seemed to go down 5%. But if you look at the highest typical price among the facilities, you can see that now the highest is much higher than it was in 2017. So like the spread of prices increased instead of the opposite, which would be ideal. And that holds true for C-section, for the upper GI endoscopy also, for the knee arthroscopy, and for the risk test rate. And this risk test rate is something very, very simple, but you can see how the spread increased. And in the upper GI endoscopy, that's also a very common procedure that, I don't know, but a lot of us are gonna have it at some point. So it's good to know how much it's gonna cost and why the variation is happening. And next one, please. Yeah, I think I'm running out of time. So, so just quickly, just to mention that Colorado is one of the only states to earn an A or B grade from Catalyst for Payment Reform in transparency law. So and one of the reasons is because we have a shop for care tool and we have improved and increasing the number of procedures available over the years. And this website and this web page in particular has over 50,000 views since the launch, which was just recently at the beginning of the year. So that makes us proud, and we hope to keep improving it and make it more usable. This this tool has been used by the Colorado Medical Society, and it has been added to the curriculum, medical student curriculum for referrals. I know that prices is always sometimes in the mind of providers, particularly when they treat low income and uninsured patients, and they want to make sure that they are able to get the services and the screenings and the tests that they need to take care of themselves. So they are learning to use this service as one of the tools. I've learned from care coordinators who can use this tool to refer patients to the places that are more convenient to them also. Next one, please. And just why should we use something like that? Well, in the short term, because potentially we can save some costs in that specific procedure we're looking for. But in the long term, even if we are insured, we can contribute to lowering premiums for services specifically. And I would add, just because it is the right thing to do, we shouldn't be paying much more money for something that can be done by less money. And we should together pull to close that gap between that, like the low and the high price, and make it more reasonable, and make sure that everyone can access this information. And this is just a quote from one of the consumers who used the tool and was kind enough to communicate us how he used it, and the result, he could save money because he proved that these are the prices, and you can make a discount, and he did it. So that was great for us to hear, because the more we hear that, is just like it's good that we can do this together. Next one, please. So what we can do all together is shop for care when we need healthcare services, spread the word to family, friends, and social media, share with colleagues and employees. I don't know, just spread the word. And even if we have low deductible plan, we can make a positive change. And again, I want to say, just because it is the right thing to do, to have affordable services for everyone and available for everyone. We know, we are very mindful, thank you, Laura, that this is not the best way to access information for many people, not only because of the language barrier, because of other barriers also, like many people don't have access to computers. So we look into having this in Spanish and having this more friendly on a smartphone also. And also to make sure that this is disseminated in the right groups and by care coordinators and other community groups that might benefit from using it. And we are always open to go and talk and work with any groups that you might feel they can benefit from this.